First of all, we got to deal with the Democrats in the House. They say they may have the votes. They may have the votes to pass Obamacare bill tomorrow, the government takeover of the health care sector. Now, not so fast, says my next guest. Here we have Republican Congressman Paul Ryan from the great state of Wisconsin. Now, Paul, I thought I heard earlier, you tell me, that Majority Leader Steny Hoyer is saying they may not have the votes. They may have to postpone the Saturday vote. Can you fill us in on the fate of the health care takeover?
Yeah, the latest intelligence, Larry, we have is that they're down about 10 votes. But they seem willing to bring this to the floor if they're down, say, 5 or 6 votes. So they're bringing the president to the Capitol tomorrow. They're having members of Congress on the fence go talk to him personally and individually to try and pressure these votes. What they find is, and the pattern of this majority is, even if there are a handful of votes down, they feel they need to bring the bill to the floor to get them off the dime, to pressure them to vote for this thing. So I wouldn't be surprised if this thing goes to the floor tomorrow, even though they're down and they think they'll be able to muscle the rest of the votes. They're bringing the big guy in tomorrow, the president, to try and bring this thing home and twist the arms of these blue dogs to get them to bring this thing over the finish line. And that's what we think is going to probably end up happening tomorrow. If they don't bring the floor tomorrow, that means they are over 10 votes down, and they're going to try and get those votes and keep us here. They're not going to let people go home, talk to the constituents. They're telling us they're keeping us here until they get the votes to pass this.
All right, under lock and key. Now, it's true the big guy's coming in, although he hasn't had such a great quarter, right? He didn't do so well in Copenhagen with the Olympics. He didn't do so well in New Jersey for John Corzine, but he hopes to do better when he comes up to the Hill. Paul, I don't know if you heard us talk about the death of small business jobs. I mean, the numbers today were absolutely incredible. There's almost 600,000 jobs lost in the small business sector this month. Last month, 800,000. The month before, 400,000. What will this health care bill do to small businesses and their job creation?
If you use Christina Romer's multiplier, her economic model, the Obama administration's economic model, and apply it to this bill, it will cost us 5.5 million jobs. A surtax on small businesses, bringing the small business top tax rate to 45%. In Wisconsin, that top tax rate is 54.27%. If you take a look at the 8% payroll tax on all those employers who are going to shift their employees into the public plan, into the exchange, that's a 23% payroll tax on those workers in those firms. Outside actuaries are telling us from 50 to 66% of employers are going to dump their people into the exchange. That means that many employers with a 23% payroll tax on their employees, a 45% federal top tax rate on small businesses, and we're going to do this in the middle of a recession when we have 10.2% unemployment. I mean, so technically we're probably out of this recession, but this is a surefire way of getting us back into one.
You know, I learned this morning from the Wall Street Journal editorial page, I did not know this, you may have known this, that inflation indexing of the personal income tax brackets is being removed in this bill. That is incredible. What can you tell us about that?
Yeah, they restored bracket creep into the top rate bracket. So the surtax that Steve Moore was talking about in your last segment is fixed at these rates. So yes, they will restore bracket creep into the top tax rate. And that is because they need the cash. That is simply so they can get the kind of score they need from the Joint Committee on Taxation and the Congressional Budget Office to try and give the illusion that this thing is paid for. What they also did was they took what we call the doc fix, all this payment for doctors outside of the bill, passing it separately, and then they're joining the bills later on. That's a good $200 billion deficit. Our estimates, our numbers of the House Budget Committee, Senate Budget Committee, we think this thing's going to cost $1.7 trillion in the first 10 years and probably a little more like $3 trillion in the second 10 years. That's not all paid for.
And this is like a 1970s thing. By taking the indexation out, you're going to start picking up people lower and lower and lower in incomes. Now, Paul, I know you got to go. Let me just fire 2 quickies at you, please. First of all, the Republicans have a plan, an alternative health care reform plan. Will you have a vote on that plan tomorrow?
Well, Steny Hoyer is telling us we will get a vote on our substitute plan. So, yes, I think we will.
All right. And does that have the interstate insurance deregulation?
Medical liability reform, interstate shopping, let people bulk buy their health insurance in big buying pools, the kinds of reforms that we know and have proven and CBO certifies brings down the cost of health insurance.
And the last one, Paul, you're great. After the election on Tuesday, what are the blue dog Democrats going to do? Because if there ever was a message, I would think the blue dogs would hear it, that the country does not want this big government spending takeover. But you tell me, what's your forecast about the blue dogs? Do they go with Pelosi and the majority?
The blue dogs have a choice. Pick the party or the people. And they're going to have to tell the president to his face what that choice is. So it is up to the nerve of each individual blue dog tomorrow to see whether that succeeds or not. That's it. It's coming down to that. Blue dogs are going to pick their party, or they're going to pick the people they represent, and we'll only know tomorrow.
All right, Paul Ryan, one of the real brainiacs among the House Republicans from the great state of Wisconsin. Thank you, Paul, for your time this evening.
Larry.
All right, folks, let's go back to our